Hello and welcome to our live hangout today. This one today is called The Truth About Skin Cancer with Dr. Jeffrey Rapaport. My name is Craig Ewan and I'll be your host today. Now in today's hangout you're going to learn everything you ever want to know about skin cancer. What it is, the warning signs, prevention, how to deal with it, screening, everything you need to know or ever thought about regarding skin cancer. So good morning, Dr. Rapaport.
Good morning. Thanks for having me again. It's good to see you.
It's absolutely excellent. Now, I have a whole list, as I normally do, of questions, and the research that I do, I think it's going to be easy to jump in and show some pictures. But my first question would be, what is skin cancer? I mean, who is affected by skin cancer? Some statistics. You probably scare us, but there must be some numbers, or what particularly is skin cancer? And then maybe
first let me answer what is skin cancer. Skin cancer is the uncontrolled growth of cells in the skin. For instance, basal cell carcinoma is a type of skin cancer that occurs from the bottom of the skin cells. You can have squamous cells from the top of the skin cells, and melanoma from the pigment-producing skin cells. So when any of these particular cells starts uncontrolled growth, meaning that the body cannot, it fights it, but cannot stop these cells from multiplying, then you have the potential, and then you start developing skin cancer. Now, the thing that you need to remember is that skin cancer is the most common form of cancer in the United States. There are about 3.5 million cases of skin cancer per year.
Ooh.
And if you were to take the cases of colon cancer, prostate cancer, of a whole bunch of other cancers, there's more skin cancer than there is of any of these other cancers combined.
Wow.
So it's a real epidemic.
And do you want to jump in? I mean, obviously that's a good explanation of what skin cancer is. Do you want to jump into some pictures so you show people pictures at this stage? Would that be helpful?
Sure, we could do that.
Let me just put on some pictures. At least people can identify the different types of skin cancer that there are. Then we can go into some of the other questions of prevention and how you can get this and what to do about it. Let me just, I have to share this screen, so just bear with me a second. I've got to find how to share the screen today. Okay, just hold on. Here we go, I think. Okay, so I think we can now see well, I pulled off on the cancer. This is off at skincancer.org, which is I've blown it up slightly, but at least you can see the different skin cancers there.
Craig, I think this is from the Skin Cancer Foundation, and
skincancer.org. Yes.
Okay, and this is for what people should look for, and it's a very basic example. I want to start by stressing that, saying that if anybody has any moles or lesions that have changed in size, color, texture, whatever, that the most definitive way is to go see a professional, a medical professional, and have them looked at. Because the things that you need, main thing that you need to remember if you take home anything from this hangout is that all of these skin cancers are preventable and curable if diagnosed early and treated. If you wait too long, they can be deadly. So actinic keratosis is a very, very common, that's what you see on the left. It usually starts as a rough, scaly patch. almost everybody over the age of 80 years old has them. It comes from sun or ultraviolet exposure. It can lead to basal cells, squamous cells, and more commonly the squamous cells, and not too often to melanoma. And it feels like a rough patch. So if you live in a sunny area like you do, Craig, and you start rubbing your fingers over your forehead and you feel rough areas, that most likely is actinic keratosis, which you see on the left.
Right.
The next thing is basal cell carcinoma, and this is an example of one type of basal cell carcinoma, which we call nodular, which is a solid growth. The thing with basal cell carcinomas and all of these is that they can have many, many different appearances. The basal cell carcinoma is usually a shiny area. It can be flat, it can be raised, and it often has dilated blood vessels on it, and it will bleed and then heal and bleed and then heal. That is a typical, the bleeding and healing is a typical symptom of basal cells and squamous cell carcinomas, not melanomas. Dysplastic nevi is a very highly debatable issue at this point. That's in the middle. Some people feel that dysplastic nevi are precursors for melanoma. The latest studies show that only a certain number of them are, not as many as we thought, and it's probably less than about 20%, but what we end up doing is if we think that they look highly atypical, we will consider sampling that.
Mm-hmm.
The next thing is melanoma on the right side, and the classic descriptions of melanoma have always been the ABCDs of melanoma, which is that the lesion is asymmetric, meaning if you draw a line down any part of the lesion, that half will not match the other half. The border is irregular. You'll notice that it's not nice and round. The color usually has 1 or 2 or 3 different colors. Believe it or not, the colors of the American flag are the worst colors to have, red, white, or blue. And another thing that has changed recently is that they used to say that if the D was the diameter, if it was 6 millimeters or less, it really wasn't that dangerous, but we've just seen studies come out that 25 to 35% of melanomas are actually found that are less than 6 millimeters. So I don't want your and my listeners to use the diameter as a major factor, but just the asymmetry, the border, or the color. Squamous cell carcinoma usually occurs on the sun-exposed areas as basal cell carcinoma does. It looks like a crust like this. It can also be a non-healing sore. It can also be something that bleeds. The areas of this is a lip. The areas of squamous cell carcinoma that are pretty common are on the sun-exposed areas, such as the lip, the ear, the hands, and the legs.
Right.
Scalp also, by the way. If someone is balding, the scalp is very commonplace for squamous.
Yes, I had a friend that had that issue, yes, and he had a bald head. Is it the melanoma out of all these skin cancer types that's the most prevalent, the most problematic?
Not at all. The most prevalent is the basal cell carcinoma. And
right.
Basal cell carcinoma probably has about 60 to 70% of all the type of skin cancers. Fortunately, it's the easiest to treat, and it has it is the least ominous in that the chances of it metastasizing or spreading to areas that are other than local are less than 2%, and the death rate is very, very low with basal cell carcinoma. So fortunately, we see that. The second most common is the squamous cell carcinoma, and then the melanoma, fortunately, is the least common.
Now, I have the melanoma, the ABCDE, if that will help. Do you want me to show that graphic?
You could show it. I don't want people to think about the D, because the D has, in the last 6 months, has come out as not a really good predictor, but show that.
Okay, let me just blow this up slightly. It might go blurred a little, but it might just show at least the normal and the cancerous.
You know, while we're waiting, you see that on the upper right-hand corner, someone has a large hat on, which I think is a great thing to show. And we're back to picture of you.
Yeah, I know. Well, these Google Hangouts, you do your best to. It's quite a bit, sometimes a bit fiddly, to get the right image you're looking for on the screen. So let me just fiddle around.
What else do you have besides the ABCDs? Do you have anything else?
No, that's what I found. Typically, those are the ones that I found.
Okay, I think we went over adequately the ABCDs, the asymmetry on that melanoma picture, the border that is scalloped or not regularly round, the color that has more than one color, it's not uniform, and remember red, white, and blue is bad, and then the D for diameter, I don't want people really to remember because they have found a significant number of skin cancers in people who have them smaller than 6 millimeters. So I don't really think we need to go into that.
Okay. All right. Well, let's continue on. I think we've got you on the screen right now. So, I mean, who would be at risk for skin cancer?
Everybody is at risk for skin cancer, Craig. That's why this is such an important hangout. Everybody is at risk for skin cancer. Ultraviolet radiation is the #1 cause for skin cancer, and almost everybody goes out in the sun. The sun feels great. It produces different types of hormone responses that make you feel good, and it tricks the body into staying in the sun. And anybody who goes outside during daylight hours has the potential for developing skin cancer.
Mm-hmm. Right. So that's you, me, everybody.
Everybody. Now remember, people like yourselves that are closer to the equator where the sun radiation is stronger have even a more chance of developing skin cancer. People that live in Maine or more northern climes. Although it should be mentioned that if you go to the beach or if you do skiing and other things like that, that the radiation from the sun can reflect off the sand or off the snow, can make it just as bad. But when you have higher doses of radiation closer to the equator, that is more of a worrisome situation.
Right. So what ages should you start looking at getting a screening? I mean, where would you typically get a screening? Because I mean, there's that many different pictures, and when I Googled skin cancer, you get all these scary pictures and images, and you scare yourself silly when you go anywhere near Google and put in words and see all these pictures. But what sort of age would you? Is it an age factor, or is it something that's?
It definitely is an age factor, but I'm going to give you some facts that'll blow you away, because now they have found skin cancer melanomas in kids between the age of 1 and 10. They also have found that between 10 and 20, the incidence of melanoma is rising dramatically. So before, we used to screen people 30, 40 years of age. Now it's incumbent upon the pediatricians and the adolescent doctors to screen their patients even under between the ages of 0 and 10. Because it's rare, but you will see, we have seen in the office 8 or 9-year-olds with melanoma, and definitely the incidence is rising dramatically between 10 and 20. And then if you want to pick the death rate between 25 and 30, melanoma is probably the second most common cause of death in that age group from cancer.
Wow.
So you really got to start young. Now the other thing is, as I told you, people who are 80 years old, probably it's just like prostate cancer. Almost everybody 80 years old has some form of prostate atypicality. Almost everybody at the age of 80 has actinic keratosis and precancerous lesions. So my answer to you is that everybody needs to be screened from the age of 1 on, because what's happening is that the ozone layer that we used to rely on to absorb some of this radiation is going away. And with the loss of the ozone layer, the amount of radiation that hits people that go outside is tremendous. There's a couple other things that are particularly worrisome, and that is the tanning salon or tanning parlors, which are being used by it's a $5 billion industry. And if I give you the numbers on the increase in skin cancer for people that go to skin tanning salons, if you go one time to a skin tanning salon, you have a 25% increase chance of developing a melanoma. If
Really?
you go multiple times, it can go up to 50 or 60% increased chances of developing a melanoma. If you have one sunburn, you go up about 20%. If you have a blistering, let me say that again. If you have a severe sunburn, you're somewhere around 25 or 30% increased chance of developing a skin cancer. So there's so many different ways that you can absorb and get ultraviolet radiation, and all the ultraviolet radiation does, it goes in and it changes the genomes, and it mutates the DNA in the cells, and those mutated DNA will then go and develop skin cancer. That's how it happens.
Wow, that's quite frightening. I mean, the sunbed issue. Are you saying regards sunbeds? That is every type of sunbed, or is there a type of sun? Because that's
there is no, absolutely every type of sunbed will dramatically increase your incidence, and it's mainly teenagers that are going to these sunbeds, and we're going to see unbelievable amounts of skin cancer as these teenagers get older. There is the thing I want you to remember is that there is no such thing as a safe tan. Period. There is no safe tan. If you're tan, you've caused damage to the skin. What happens is tanning is a response of the body to prevent the sun from continuing to damage the body. So if you're developing a tan, it is it's the body trying to fight off additional sun coming in, and it's a protective response. So any tanning, even though we think it looks great, anybody who has a tan means that they've caused damage to their skin.
okay.
There is no safe tan.
So no safe tan at all. What about even the beach? So
there is no safe tan. Period. Period.
So
if you go to the beach and you get tan, you have a higher incidence of developing all of these things. Even if you use a sunscreen and you don't get tan, that's great. Now, so I have every day people coming in and telling me they're coming in and they look as bronze as Arnold Schwarzenegger, and they'll come in and they'll tell me, but I used a sunscreen, so I'm not worried, which is a total bunch of malarkey, because the sunscreen, if it works, is to prevent you from getting tan, not to give you a nice glow, etc., etc. If you develop a tan, you are causing damage to your skin.
Wow. So you can't go on sunbeds, you can't do the sun tanning, you can't go to the beach, you can't sit in the sun.
You can go to the beach. First of all, a couple of things you should remember. The sun tanning rays are the heaviest between 10 and 4. So if you really like walking on the beach, which I do, I usually walk between 5 and 6. That's the time when the sun tanning rays are the least, and I wear a sunscreen. I cover up I wear a big hat. I cover up wearing long sleeves. People call me the kabuki man. I like to play golf. I do the same thing. I wear heavy sunscreen on my face. I have long sleeves on, long pants, and a big hat, and a lot of sunscreen, because any area that gets tanned has an increased incidence of developing skin cancer.
Right. Moral of the story, stay out of the sun. So I go in the sun.
That's exactly right. Or if you're going to stay, or if you want to go in the sun, go in after 4 o'clock or before 10 o'clock.
Okay. Well, it sounds. I grew up with sunbed. I was in the health club business in Europe. We had sun tanning. Obviously, it's a big industry. I've been on sunbeds when I was younger. I go on vacations. I sit in the sun. I live in Florida. I sit on the beach. My family does the same. Now I'm pretty worried. I'm in my mid-40s. I I should be doing something about this, just like everybody who's listening, we should be doing something. Is there something we can be analyze? Tell me the procedure. Do we analyze ourselves first and then call up like yourself for a screening? How does this whole self-identification or come in for screening, how does that process work? So I feel secure that I'm good to go.
Okay.
I'm all right. Do you just do a visual check? Do you take blood work? How does that process work?
The first part of the process is that you need to do self-examination. And if you see any moles that are continuously bleeding or changing size, color, shape, or any of them that look like what we showed you, that's something that you need to bring to the attention of a skincare professional, which most commonly is a dermatologist. If you don't really have access to a dermatologist, go to your primary care doctor, have him look at it. The second thing is that you should have your spouse or significant other check your back and other areas that you really can't see and see if there are any changes in any moles or things that are not healing or things that look funny. A lot of the times, 50% of the times, melanomas will be picked up by the spouse, especially if it's on the back.
Right.
And Craig, it's believe it or not, males have a much worse prognosis with melanoma than females do after the age of 40. The survival rate is much lower, and the incidence is much higher.
Right.
So it's important for you to check yourself as best as you can, and for you to have your spouse or significant other check you to see if there's any changes going on.
So self-diagnose and then call up a skincare professional.
And then if you see, now the other thing, let me just say.
Could I not come in anyway? You
could come in anyway. I belong to the American Academy of Dermatology, and I'm the chairman at Holy Name Hospital of Dermatology, and every year in May, it's funny that we're talking about this now, May is Skin Cancer Awareness Month, and almost every hospital or skincare organization will do free skin cancer screenings, free, in the month of May. And I highly recommend that our listeners make themselves available for this. You just walk in, it takes 15 minutes, and you will have a skincare professional that will check you. It's a lot easier than going to a doctor's office if you like. If you don't go there regularly or unless you have some sort of skin problems, and get yourself checked. If you have a family history of melanoma, you definitely need to be checked every year. If you have a personal history of melanoma, you should probably go every 6 months. People who've had one skin cancer have such a higher incidence of developing a second skin cancer. It's tremendously higher, 8 to 10 times higher. So you really need to be able to, if you've had a skin cancer, to go back and double check on that. And then if there's a family history, you need to go more often also. You have to be much more aware.
Wow. So, and you would suggest children too then?
Absolutely. Children of people who've had melanoma,
yeah.
and I would recommend all children. It's rare, but there is an incidence of melanoma in children at this point.
Okay. All right. So since it's Skin Awareness Month, I think I'm going to do that myself. Definitely, because I think you can still check yourself, but you're still not 100% sure what you're looking at. So I'd still want a professional to look at me.
Absolutely, and these days, if you can't afford a professional, or if you there's plenty of people that come that they just they want to get in and out rather than waiting in the doctor's office. So, or their insurance have changed with Obamacare. Who knows if you have insurance or you don't have insurance with Obamacare? Who knows if Obamacare is going to pay for preventative care like this? So go to a skin cancer screening. There are at least 2 or 3 or 4 million people that are screened every year by skin cancer screening programs in the month of May. Look for them, particularly this up-and-coming month of May.
Oh, okay.
Actually, today's May 1st. So
oh, yes, absolutely, as we're recording this. So say, for instance, I come in your office, we find something, so we don't get people scared from coming in. You know, some people are scared to go to the dentist, for example, through fear of the cost involved and what might hurt or what might be found and all these types of things. Just trying to alleviate the listeners that after a screening and something's found, just talk through that process of what you would do as a skincare professional once you've done a screening and you were to find something. What would the process be then?
Depends what's found. If it's actinic keratosis, which we think are precancerous spots, we can give you a cream or we can spray it with something like liquid nitrogen. If we're concerned about an actual skin cancer, a basal cell, a squamous cell, or a melanoma, usually a small little piece of that will be taken and sent into a laboratory. It's not a big deal. You have usually a mildly uncomfortable little injection to numb the area, and then a small little piece of the specimen is taken and sent to the laboratory. And it's all over in less than 2 minutes. And it's certainly a lot easier than having a cavity drilled where you need all sorts of either gas or you have a big injection and it hurts. This is really not very painful at all.
Right.
And it tells us after we take the biopsy specimen whether or not you have skin cancer or you don't have skin cancer. And depending upon the type of skin cancer that you have, the treatment can either be done by the doctor who did the biopsy, or if it's in the areas that are sensitive, like the ears or around the eyes or on the face, we have a special doctor called a Mohs surgeon, M-O-H-S surgeon, named after Frederick Mohs, who developed the procedure. And what that doctor will do is he will remove the cancer layer by layer to give you the highest cure rate. And the highest cure rate is probably 98 to 99% cured.
Oh, wow.
Now, that usually is for squamous cell or basal cell. If it's a melanoma, you have to hope that the melanoma is at an early stage. If it's at an early stage, it's 98% curable. If it's spread to just the local lymph nodes, it's about 68% curable. If it's spread beyond that point, then the cure rate goes down.
Right. So, like all these problems, prevention is better than trying to cure at a later stage. So, get a screening early on, so you can take some preventative action.
The earlier that you uncover any of these skin cancers, early skin cancer is preventable and curable, and that's why this hangout is so valuable, because if you can get it early and you can treat it, it's curable. If you put your head in the sand and you don't want to leave it, etc., then it keeps growing and growing, and then you have a problem.
All right. So, talking about prevention, I can see it's like, depending on what cancer you have and what stage you can identify it, what's important here is first get a screening ASAP. Makes sense in this month because it's Skin Awareness Month. Go to a professional, get tested. If you catch it early enough, depending on the cancer, 98 to 99% curable.
Right.
But stay out of the sun completely, whether it be sun tanning beds, whether it be the beach, whether it be on the cruise, whatever you're doing, stay out of the sun.
Or if you have to go in the sun, then you need to wear sunscreen. I recommend.
You're just coming to my exact question. Please give us some preventative things that people can do, whether just preventative means, and if you can elaborate on SPFs, sun creams, good, bad, ugly, if you can just give us some preventative solutions.
Well, the number one preventative thing I told you before, if you're going to be in the sun, go in the sun before 10 or after 4. If you have to go in the sun, you should wear clothes that cover up the exposed areas. Okay, large hat, large brim hat, long sleeves, etc. If you're not as gung-ho as I am, and not everybody is, at least do this with the kids, because your kids are like a radiation badge. The total exposure that they have over a lifetime is what's important. So
Right.
you got to wear the kids have to wear the rash guards. The kids should stay in the shade. The kids should wear hats, etc. I highly recommend a pediatric sunscreen for the kids. And what if you'll investigate what pediatric sunscreens really are? They're sunscreens that don't have chemicals. And when I recommend to my patients, even who are not pediatric, sunscreens, I recommend chemical-free sunscreens, mineral sunscreens, because I'm not so sure somewhere down the line that some of these chemicals that are in the sunscreen may not be the best thing to be putting on at high concentrations all the time.
Okay.
So I recommend a mineral or chemical-free sunscreen. They're available all around. They're much better now than what the old lifeguard used to wear with the big white thing on his nose.
Yeah.
They make chemical sunscreens that now are either zinc or titanium, and they end up micronizing them so that they blend into the, you can rub them in. And the micronized sunscreens work really, really well. The other thing that people shouldn't forget is that they should wear sunglasses, because sunglasses, when you buy them, don't buy a total cheapy pair. Get yourself a sunglass that has ultraviolet radiation blockers. There should be 100% blockage of the sun with an ultraviolet screen in the sunglasses, because you can cause damage to the cornea from the sun if your sunglasses don't have UV protection in them.
Now, is that UV protection, is that different to the sunglasses? Oh, what's the other word for that you have on sunglasses? Like you buy a pair of Ray-Bans or something.
You mean like coatings and stuff like that?
Yes, like.
Well, first of all, almost all of the better brands like Ray-Ban are going to be, if they'll have a little sticker on them that say 100% UV protection.
That's what you're looking for.
That's what you're looking for.
UV protection sticker.
Yes.
And talk about SPF. I mean, there's different levels. I mean,
okay. Well, here's the SPF is an interesting story, because if you'll read what the different organizations recommend, they recommend 15 to 30 SPF. But I have to tell you that the biggest problem with putting on sunscreen in this country is that those SPFs are determined by using 4 to 6 ounces of sunscreen all over the body, and nobody uses that much. So what I tell people to do is get the highest SPF that they can, because I know that they're not going to put on enough sunscreen. You really have to fill your whole palm up with sunscreen for an SPF 15 sunscreen to really be a 15. If you use, like most people do, a little bit here and a little bit there, then you're better off with a higher number, because the higher number, when it's diluted out all over the body, will give you the same as the 15 that you put on in adequate amounts.
Right.
So I recommend the higher numbers, because I know that people don't put enough sunscreen on.
What do you regard as a high number?
50, 60.
50, 60.
Mm-hmm.
Right. Just making notes as you speak. Okay. Excellent. So I spend a lot of time in Europe. I just have this other question. When you see all these, you travel around Spain or the south of France or somewhere, and you see all these old ladies sat on the streets having a drink in the afternoon, and they've got like really, really wrinkly, and they're sitting out in the sun all their life in all these little harbour towns in Europe, south of France or Spain. Are we saying that they probably all got cancer then?
A lot of it has to do with genetics, but what I can tell you is that if you use sunscreens from an early age, we know that it has a tremendous anti-aging benefit, and you'll end up looking younger and better if you use sunscreen for your whole life. Part of the wrinkling is from age, and most of the wrinkling is that people get in this country is from the sun. So if you want to keep yourself looking young and great like you do now, you should use sunscreen. Sunscreens definitely has a tremendous anti-aging effect.
And some of those ladies, they look like grapes.
Yeah, well, that shows you what happens if you don't use sunscreen and you get a lot of sun exposure.
Yeah, exactly.
They look like raisins, is what
That's it. That's what I meant. I meant to raisin rather than the grape. Yeah, exactly. Well, I found this very enlightening for me. I know this month, May, it just happens to be ironic that it's Skin Cancer Awareness Month that we're doing this, but I'm going to certainly get checked out and have my family looked at. I think I'd rather personally have a professional check me out as opposed to, yes, I can look at myself, but still, as you age, I am definitely getting age spots, moles. You know, there's things that change that I don't really know myself, so I'd rather go to a professional and get screened. So if somebody was calling your office, because I know cosmeticskin.com is the website, you have offices in that do the, I know you have many offices, but your offices where you do your cancer screening is Old Bridge and Hyland Park. Is that correct?
Old Bridge, Hyland Park, and Englewood Cliffs. We do.
Okay, Aldridge, Hyland Park, and Englewood Cliffs. So what would the procedure be? I mean, somebody to just call your office, go to Cosmetic Skin, call the office, book themselves,
and then request a full body examination.
Right. And would that be conducted by you?
Sometimes it's by me. Sometimes it's by people who I've specifically trained to do this. It depends upon. I can't be in all the offices at all the time. You know, at all times.
Is this a case? I mean, sometimes you look at skin cancer. Is this a case where everybody sees the same thing in dermatology? I mean, is one doctor different to another? Why should somebody choose to go to Cosmetic Skin or Dr. Jeffrey Rapaport for their screening as opposed to somewhere else? Is there a big dramatic difference in this particular field or not, of who you choose professionally?
I think a lot of it has to do with the time that I think most of the professionals that we have doing screenings are very capable of doing the screening. The question is, number one, will they take the time? And number two, will they be thorough?
Right.
And all the people that work with me are very thorough and will take the time. They will make sure they will do the things that a lot of people don't do. They'll look between the toes, they'll look behind your ears, they'll look on your in your hair. A lot of people do the 1-2 quick screenings, and we, in our group of providers, we take our time and we really check everything out. So that's an advantage that I think we have over other people. But I would say that most dermatologists do a good job on screening. I think that this is sort of a basic thing for dermatology, and I think if they take the time, they all can do a very, very good job.
Excellent. Well, I've learned a tremendous amount on this hangout, and I think this is one thing. A lot of the other things that we talk about are elective treatments. You know, the other things that we've spoken about, reducing fat and various other things, are all very elective as a cosmetic treatment to have something changed on the body. But this is something essentially that everybody should be doing and having checked out. You know, this is for everybody. So I found this very, very interesting. On closing, is there anything else you'd like to cover or say that I've maybe missed in my questioning?
I want to mention the two things that I told, the two mantras of skin cancer, and that is skin cancer is preventable and curable when discovered early. And then the second mantra is there is no such thing as a safe tan. It doesn't exist. There is no free lunch. If you have a tan, you've caused damage to your skin. Those are the two things.
Right. Excellent. Lovely. Well, thank you again, Dr. Rapaport, for this enlightening hangout. Well, I know we've had a couple of technical issues on this one, but that's how this technology goes. But I appreciate your time, and anybody watching, certainly Cosmetic Skin, that's where you need to head to book the cancer screening in Dr. Rapaport's offices in either Old Bridge, Hyland Park, or Englewood Cliffs. So everybody have a great day, and thank you, Dr. Rapaport.
Good to see you, Craig.
Thank you.
Take care.
And you. Bye.